Great, so we have got this little piggy who is a female who has developed a tiny little bump, which is in fact a sebaceous cyst, or we're going to check first to see that it is. It certainly feels that way, but it's right here. You can't tell with an Abyssinian, you know, how hidden away it is. So we're going to try and, how do I work this? There we go. It actually has a top opening to this little lump already, as though she has nipped at it. So we will be able to see that in just a minute. Okay, a good margin around it. I know, it's a bit scary, little girl, this noise. But you'll see in a moment where the top is actually open to this cyst. Now when you've got a top or an area that's already open, you then have the question, do you need to lance the area? And that's what we're going to work out now. I'll just do a nice little pattern on you, little one. Great. And you can see the lump there, which is good. But with this lump, you'll notice, see the little top opening? It's very small, but there, and look, I'm even touching it, it's coming out, so I don't even need to lance this. So literally what I'm doing is applying a little bit of pressure. Can you see that close enough? But literally it's like oozing out. I know, little girl. So we haven't had to do anything in this instance. But we do have to get this snake-like ribbon out of here, which we will, I know, it's going to continue coming out for a minute. Which they do not like, you know, this squeezing motion, but it's, you can see, oh, would you mind grabbing me a tissue there? We can put this little structure on there, and we're just going to continue at the base, moving this out until we have no more. Because the least invasive we can be is going to bring about the best healing for an animal. And she's getting a bit cranky with me doing this. I know, I'm sorry, sweetie pie. But we'll put that down there. We really just want it to be as least invasive as possible. But the biggest issue with sebaceous cysts like this is that they're cleaned fully and well enough. People will talk about the sac. These sebaceous cysts contain this hard material, keratinous material, which is skin cells, dead skin cells, and in some instances bacteria and other things. But it is literally a pocket in between the tissues of the skin. And what we're doing, if we clean it properly, it should seal normally. So there's no sac to cut out or remove or chop away. And if it's done well enough, this won't return. That's it. That would be the end. I know. You really are not happy with me. But actually, you're a whole lot better off than if I had had to lance that. I know, sweetie pie. So I'm just doing it very slowly, a bit of pressure on there. You can still see it slowly coming out. She does not want me to do it. There we go. But there's still material there that we have to get out. So I'm just doing it ever so slowly so that she can concentrate. Maybe if she has some grass she can nibble, you might be able to just hand her something while we just work on the rest of this coming out. Well, looks like my son has arrived back. Sorry, sweetie. You're really trying to not... Oh no. The bit that's in there is a little bit more stubborn. A little bit more stubborn. No, no, it's coming. It's coming. It's coming. It's coming. It's just a bit more stubborn.
Yeah.
Try that. Try nibbling on that just for a minute.
There we go.
That's it. Good girl. Good. Yay. Good girl. Get a little bit distracted with that, just while I try and edge out the rest of this. Now, to actually dislodge the rest of it, I've got to go crossways, which she won't like. Sweetie pie, I'm sorry. I'll get it done really, really quick for you. There you go. You see that coming
If you'd
up?
like, I can hold her this way, and you can use the other direction.
Yeah, I'm just trying to... There you go, smelly all out. Smelly there. So when you've gone this way, it's a good idea to go that way.
Yeah, I did that.
I can still feel a portion of it there. And you've got to make sure it's not there. You can see the rest of it coming out. I know, sweetie pie. So that we have it completely empty.
Yeah, look, grass. Here, yummy grass. Here you go.
There we go. Here it comes. Good, good, good.
Look, yummy
Here
grass.
it comes. Good girl. Girl. Okay. Nearly there. And this is so much easier to deal with now at this stage than if it's complicated by infection and, you know, some of the bigger ones that you see me deal with.
Yeah, hey grass.
There we go. Smelly all out.
Grass. Eat grass.
Nearly there. Good girl. We are getting there. There we go. We're getting to the bottom of it finally. And a lot of people stop before they realise they have the entire content in that cavity. And so you've got to carefully feel. There's just a bit more there.
Grass.
So she's munching away on her grass. There we go. There we go. Really happy with that. So, lucky fingers completely. But that looks good. So now we're just going to flush that out, which will also bring a little bit more out. Just wait, there's a bit more just there that I need to get that. This will be so much better. It'll take a few weeks for her coat to fully regrow, but what we do is using Debrazole, that little tiny area, we didn't lance that, but I'm literally going to work the syringe just with the Debrazole in around there.
So it's okay that it falls on the side of this?
Yeah, because it's actually disinfecting this area anyway. But where you do with other piggies, like on the head, you do not want this going in eyes or you know, the face in any way, unless you know where it's going.
Good.
I'm just filling that. You see, I filled it up with the. Filled it up.
Do you need more?
With, no, I'm happy with that. So it's going to literally pat dry like that, and all we're going to do is pop a little antibiotic spray on that. Now, the advantage of lancing something like this is that you can really have an opening to heal from the inside out, but when it's a little tiny hole like that, it's very easy for it to block. Very easy for it to block, and you have to keep an eye on that at all times. So let me just check this here. Yeah, there's still more there, sorry.
You are
Just
high
really
maintenance, boy. A bit more.
Make sure we get that out. Good. Good, good, good. That's it. Where's that hair come from? Yeah, so we may, with one like this, with the little hole that we did not create, that's the risk that you have, and it may be that this can reform, but if it does, it'll happen in the next week. We're not talking months or years later. That will start to refill, and then we will actually, the next time we would choose to lance that, which gives a better finish. But for what I'm doing here, I'm really happy with that. So we are going to let her go. Let's give you a little quick tinge of blue. Just in there, good. And she's ready to go home and have special treats, and we'll check in with her in about a week.